Okay, we are live. Hello, everybody watching us right now, and everybody joining us later on the recorded conversation. I'm super excited today. First of all, we've completed a year of FlareVet. We've done a whole year of conversations monthly. I'm, really, really happy. Yep, there you go. Super happy about this project. It all started, with a short conversation where, we wanted to see how we can create more impact other than post something on LinkedIn and kind of just, like each other's stuff and then move on and then everybody forgets. Wanted to do something more, a little more, that stays around, people can listen to, easy to listen to. And I think we've done a pretty good job with that throughout the year. So super excited. We ended up the year with two really experienced veterinarians here. Um, we have Anthony Chadwick. Everybody knows who he is. He veterinarian from the UK. I guess all of you are surgeons. We call all of you veterinary surgeons. That's the thing.
Yeah,
And
that's right.
some interest in dermatology as well. And then of course he created the webinar vet, which has helped a lot of us get some continuing education and kind of stay in the groove with what's new in vet med. Um, and then we have Dr. Jershan Alaluf, another experienced veterinarian over 30 years, who is really we share a passion about how do we keep veterinarians practicing veterinary medicine. I think him and I really have that strong passion. It's part of why I'm doing FlareVet and we're doing FlareVet is that I love doing my job so much. It really blows my mind how people get through vet school and then they leave the job. Like they just don't want to practice anymore. And that just doesn't sit right with me. And I think part of what we do is to try and keep people in veterinary medicine and do the best in that sense. And he also owns and manages Pacific Lens Studios in South California. So I think that our worlds collide pretty well in those two ways. So we're gonna talk about the current, and of course, Sammy, Bill, Chris, and me. I always do the worst intro possible for ourselves, but hopefully you'll get to know us little by little, and eventually we don't even need an intro at that point. So we're gonna talk about the current landscape of veterinary medicine, how things are going by now, by the end of 2025, and what we can do better in the future, what we can do different, and kind of like fixing veterinary medicine, right? Fixing veterinary, the whole industry, not just the how we practice medicine, but the whole landscape is a big part of FlareVet. So um, I kind of wanted to start by saying that we're in a really good position. People are adopting pets more than ever. Families are treating pets like their own family members. So we're in a really good position to do things right and capture that interest in owning pets and turn that into a really healthy industry and healthy medicine. Um, so I tend to ask direct questions to kind of get the conversation going. I want to start with Dr. Anthony Chadwick because I think part of having him here is that we learned a little bit from UK medicine and how we do things over there. I noticed a decline in wellness visits here in the US for multiple reasons. Do you think you have that going on in the UK as well, Dr. Chadwick?
Yeah, I think so. I think there's a cost of living crisis in the UK as well. So people are. It's interesting. I think through recessions and so on, people like you in America, the pet is very much for many people a big part of the family. So they will give up other things before they give up their, going to the vet to have it checked over for sickness and so on. But preventative is one of those things that you kind of think you can probably lose the quickest. And then also, I think the whole wellness plans are being remodeled because, in the UK, we're talking a lot about not using medicines unnecessarily. As a dermatologist, I used a lot of flea treatments in my time. Yes, even in the colder climes of Liverpool, we do get fleas. And there was a tendency maybe to just treat preventatively and, you know, treat every month. And there was very much, you know, from me starting as a vet and before I became a vet, you know, there weren't many products out there and none of them were, you know, particularly good. Gershon may remember products like Nuvan Top, which I think we can talk about because they're so long gone. You know, it was a organophosphate spray. The cats raced away when they saw the orange can come out in the UK because it gave out that loud sort of shh sound as the cat was sprayed. And they didn't last very long and so on. And then these better products came in. We were getting better control of flea allergy and so on. And I think the new products that came out at that time, the sort of topicals, we were sort of saying, well, we need to be using them more and more. And I think it was Mike Willard, who was a professor at Texas A&M and has done quite a lot of webinars for us. He's just retired. But he said, everything I taught you 10 years ago was a lie. So I think we do have a kind of situation where fashion comes in and fashion goes out, and we treat a certain way and then we treat a different way. When I, you know, first started going to practices when I was 12, 13, everything got an injection which had a bit of white and a bit of pink in it. And then we all thought, well, why are we giving, you know, cobalamin B12? And now we start realizing how important it is. So I think there's always cycles in veterinary medicine, and we're probably at the point now where we're pushing back a bit from preventative medicine that perhaps isn't, you know, as necessary. Obviously, if you're living somewhere like Florida where it's hot every year, the dogs are outside, the cats are outside, then treatment more regularly obviously makes sense. But in a fairly colder, temperate climate like Liverpool, do we really need to treat it as much in the winter, you know, unless we've got a severely allergic, flea allergic dog or cat, in which case, you know, more treatment is required.
So you think like people are noticing that they might not really need some things that they would get routinely, so they're not really coming in for those visits? That's kind of part of the point.
I think some of, and then it's also compliance of just people remembering to do the things as well. So I think there is some change in that, some of which is probably economic, and some of it is coming from the vets of saying, let's change it around to regular visits, but not necessarily regular treatments that may not be necessary all the time. And I know before we came on the podcast, Sammy was talking similarly about her experience in the Netherlands. I think people just not wanting to use things that aren't necessary. You know, it's kind of, it can be wasteful, can't it? If a drug isn't needed at that time, then, you know, why give it?
Gotcha. Why do you think it's, sorry, Sammy, go ahead.
Yeah, I guess following just up on that, I think there is something to that about being wasteful as a society and being wasteful as a culture. But something I have encountered now, you mentioned Florida, I've recently moved to Miami, and I was shocked at the number of people who were misinformed and were electing to, or trying to find ways to not vaccinate their pets. I think social media has been a huge issue for veterinarians, and in the US especially, there is a huge anti-vaxxer movement, and people project that onto their pets, and they don't want to vaccinate their pets, and they don't want to give the preventative because they think it's poison. But in Florida, every pet has heartworm that's a stray, you know, and so I'm curious if you have similar issues as us there in the UK.
Well, we don't have heartworm, and, you know, obviously Florida much more prone to fleas. I remember when I was at a derm conference and somebody was, I think it was Michael Dryden, who was the famous Dr. Flea, and he said he went to somebody's house, and it was a beautiful house in the middle of Florida, and on the front wall there was a plaque that says, "This is the house that the fleas built." So you know, he was doing very well out of fleas. Easier to do that in Florida than in Liverpool. Yeah, I mean, I think the problem...
rabies? But rabies?
Well, we don't have rabies.
But if they travel?
Yeah, well, that's when we obviously have to vaccinate, but they have to be vaccinated to leave the country and come back in. So if they don't get vaccinated, they can't come back into the country. So I think the problem is when diseases like parvo, you know, I was there when parvo first came out. That's how old I am. And I think Gershon is probably of a similar vintage. So it was the late 70s, and we were using cat vaccines, and everybody, people were lined up. This was kind of as a student, so not as a vet. People were lined up outside because they knew if the dog got parvovirus, it would probably die. Then as things become less common, people think, well, do I need to do that? And they stop doing it. People worry about, potential issues with vaccines, which, on the whole are very small. It's much more likely they're going to die of the disease. And we're now seeing in the UK diseases like measles becoming more common in humans for all of those reasons, people being reluctant about vaccine. So it's definitely there. And I think, people often come in and get the first vac done, maybe the puppy, second vac at 15 months old, third vac or whatever you want to call it. You need to make efforts to really get people in past that.
Right.
But of course, there are, serious diseases. We do still see distemper occasionally. Parvo pops up and out. And of course, leptospirosis has zoonotic implications. So I think vaccines, I'm a big fan of vaccinating because it obviously prevents other diseases coming in, which are then very expensive to treat, also bad for the welfare of the animals. So, I think vaccination is a good thing. The flea example, and I'm a dermatologist, if my cat doesn't look like he's got fleas in December, then I probably don't need to treat it. But I understand, in
The
Florida,
prevention
you
part,
probably want to. And
Well,
also
Dr. Alaluf, I wanted to ask you.
I'll jump in all over all this if you want me to.
I want to pick your brain on why do you think we're getting less wellness visits? Because I think it's all over the country. I think everybody's seeing a decline in those, and I want to see why do you think that's happening?
Well, it's across the board because we're in a recession and no one wants to admit it. It's between interest rates and between the cost of living, people are trying to now make a plan. Now, obviously, everyone's like, oh, this can't be a recession because everyone looks back at the Great Recession where everyone was hurting very bad. But this is a recession, and people, because of the cost of living, have to decide what is right and what is wrong. We've also made when you want to talk from an economist standpoint, we've made owning a pet almost a luxury item. So it's crazy, the cost of care now. At least here in Southern California, a routine health wellness annual exam could be $300, $400. And that's not what people really, I mean, that a lot of people don't have that sitting in their bank account. But across the board in the United States, office visits are down. So it's not a surprise, and it's always a wave. We're back to like 2019. And because, we're all still recovering from the chaos that we called COVID, as far as veterinary practices go, we're not used to not being fully booked and seeing white spaces on our appointment books. So this is not a surprise at all. And then as far as, the flea preventative goes, at least here in Southern California, it's a year-round thing. It was Dr. Drysdale out of Kansas State. He's the one who said, it only takes one flea to cause a flea allergy dermatitis because they bite an animal up to 100 times to get a full blood meal. So that is, very important. And, I remember going back here talking about, I remember when Program came out, that was like unbelievable. The cool thing about practicing in Miami or practicing here in Southern California, you're going to see more resistance to flea products a lot sooner than they do around the country. So if you start seeing fleas, even though they're on a Bravecto, NexGard, Simparica, just start making note of that because you will see it well before it happens anywhere else in the country. As far as the vaccines go, vaccines are a great way to prevent disease. There's no doubt about it. The problem I have, and I believe in vaccines, but the problem I have is that I believe that when people come in, they don't need to get 5 vaccines at once. In 2001, I changed the way we vaccinated in my practices here in Orange County, California. We started, we did the puppy thing. Absolutely. We always made sure rabies was given on its own. You don't want to, there was a veterinary vaccinologist out of Purdue that came out and did a talk, and he said, there's a greater chance of vaccine reaction if you give rabies with any other injectable vaccine. So my skin kind of turns over now when I do relief work and someone comes in with their vaccine records and I see, rattlesnake, lepto, corona, distemper parvo, rabies, injectable bordetella. And I'm thinking, man, that's like us going and getting vaccines and you get flu, shingles, meningitis and COVID all at one visit. I mean, that would totally destroy your immune system.
So you think that's the clinics trying to like capture revenue? Basically, they're pushing for that type of protocol for that reason, or practicality for the owner?
I get it from clients.
Yeah,
can't we do everything today? That's where
do?
my push comes. Oh yeah,
yeah.
Not as much as anymore, but still, can't we just make this one visit?
Yeah, exactly. Well, it's an education thing, right? And let's face it, as a veterinarian, your whole job is to educate the public. That's what we do.
I'm not disputing the validity, just saying I get more pressure from owners than you'd expect.
Yeah, education.
And I agree with that. We're failing. I think we're failing at making it important to take a break or take a second and explain why we're doing each of the things we're doing. Because when we just go in and shoot them up and leave, we're losing trust. And they start questioning even more. So taking those 5 minutes to really explain why we're doing what we're doing, I think it really has a lot to do with that. Let's just get everything today versus your way, Dr. Jershin. Okay, no, here's why we're doing it this way, right?
I think that would work potentially if you're not also charging them for an exam fee, because it's already going to cost them more money to split up the appointments. Like he's talking about, we're in a recession. You don't know, these people have to get the gas in the car. It is more difficult logistically, but it also costs them more money. And so if you're charging them a recheck fee on top of, spacing the vaccines out, then people are not going to want to do that.
I always had my technicians do the vaccine when they came back in because they already came in for their annual exam. So we already had that client-patient relationship.
Yeah,
I will say the clients who are happy to split it up have always been happy to pay the tech visit for the other fees. I haven't really encountered them saying well, I shouldn't have to pay again if I'm coming in again.
And I think that was my point.
People do expect
tailoring
that.
it, and right, and right, Bill. When we tailor it to what they expect, what they want, based on our knowledge, we get a better client, right? I mean, we just need to spend a little bit more time telling them why and how. And if we do spend that time, I think they'll comply to what our recommendations are. But if we started out as a combative, this is our protocol, if you don't like it, go somewhere else, then, we're not really doing our job.
If you do that, I guarantee you, there is at least half the world that's probably read it on a review somewhere. If you're like that,
yes, and they already don't have trust in the vaccine. So imagine after that, right?
Exactly, and and it comes back to the point of, we kind of, I don't want to say quote unquote choose our clients, right? We train our clients. You build your client base based off of just your interactions, and if you're a veterinarian and you think you're going to make every client happy, you're a fool. But
agree.
But then again, those aren't the clients you want, because if that trust isn't there, then it's going to be a much harder relationship to have.
And the patient suffers in the end.
Oh,
I think.
Yeah, and that's a whole different topic.
Yeah. So, Bill, have you noticed less wellness visits, Bill, in your clinic?
Yeah, overall, there's definitely been a drop. Not as dramatic as it is for some, but dramatic enough. It's hard to pin down why, but I think there's a we talk about clients like they're a unified, homogenous entity, and man, half the time I can't get a husband and wife to agree on a treatment plan. Like I think everybody's a little different, and I think they tend to select for us, right? Like if we think we do a good job, because the people who come back to us tell us we do a good job, and the people who didn't think we did a good job just went somewhere else, right? So it's like a really nice positive feedback loop, but we're not getting, unless we really blow it and get in, bad review, we don't get a lot of that like in between negative feedback on like what's going wrong, or we could look at compliance numbers about like how that could be better, but even that's kind of dicey because not everybody can afford everything or needs everything or any other reasons. I think vet med is a lot harder to metric than a lot of other industries. I don't know a lot about a lot of other industries, but it sure seems awful tricky in this one.
Yeah. I had a question for Sammy. Do you notice like delay of care? Like, do you get patients that are way sicker than before, like in the past few years? Like, don't you feel like sometimes they're coming in a little sicker than they used to? And that's because people are kind of like trying not to come in. And why do you think that's happening?
I think people are definitely looking for ways to sort of cut corners. In addition to, the hesitancy surrounding preventative care, the misinformation that these things are toxic, avoiding vaccines, et cetera. I find that people are looking for a way to cut corners and do things on their own at home. I think once you are a vet and everybody in your network knows that you're a vet, there's always been hey, let me text this person and ask them, or let me shoot them a Facebook message, and you get a message from someone you haven't heard from in 15 years. And it's like, my dog's limping, but can you tell me? And the answer is always, of course, go to the vet. But I do find that people are looking for ways that they can manage things on their own, looking on TikTok. They've always come in at a later date with having tried something on their own at home, whereas perhaps 10 years ago, maybe they would have just come in.
So much coconut oil.
Tea tree oil as well. Yeah. I don't know what it is.
Yeah, I get it. Like, why?
Well, we're gonna revisit the wellness visits. At the end, I want to kind of pick the brain on everybody here on how to bring those wellness visits back up, right? So we're gonna leave that more towards the end. I want to move on to something that I've noticed this year quite a bit more is how diverse you can be as a veterinarian, right? You don't have to be in a clinic all day long anymore. There's so many different ways to be a vet. You can have mobile veterinary services. You can do relief. You can own a clinic. You can sell your clinic or not. Hopefully that goes well if you do. I wanted to talk, ask Dr. Chadwick, how have you noticed that in the UK? Like, are vets changing the way they work? Like, are they like, did they used to be a certain way and we're kind of changing over now to a different way, kind of like in the US?
I think you were talking about it before, Jonathan, with also people staying within the profession, and we see that sometimes as very narrow, as in they're in practice. And we had, and I think you have the same Facebook group in US called Vet Stay Go Diversify. Yep. And that was set up by Ebony Escalona probably 10 plus years ago. I think there's a problem sometimes with retention, within practice. But, I'm not in practice anymore. I did about 25, 26 years, seeing animals. The last 10 to 15, I've been running Webinar Vet as an education business. And I think a lot of us are also quite inquisitive. So we can tend to get a bit bored just by doing one thing. So, we develop other interests. We do a bit of dermatology. Then we say, well, let's get better at dentistry. And I love the breadth when people are in practice of what we can do. I mean, it's such a diverse job anyway, just within practice. And I thoroughly enjoyed my time in practice, but for various reasons. I sold my practice 2011. My mum and dad weren't well. I just started off Webinar Vet. That was going quite well. It fitted in as a lifestyle business because I could work in the evening more and obviously doing webinars while I spent more time with my parents. And then we took on some investment. We grew the business, etc. So I stopped doing my dermatology consults as well. So I think it's a great degree to have. You know, I think it teaches us a lot of skills during that time. So it does allow us to go into, you know, industry, become a government vet, even going, you know, outside of veterinary with all the One Health and things that we have. You know, a lot of vets are interested in conservation and so on. They can go into that area. And I think on the whole, it's a good thing, although, you know, clearly we want to have enough vets in practice because, you know, vets' primary job is to treat animals, you know, who are sick or keeping animals that are well, you know, depending on what sort of practice and things you're in. And I think that is then also all down to how are we picking people in the first place. So I was actually this week in the local high school talking to a young, you know, woman who's in sixth form, you know, about to come out of school to go to university. In the UK, we do veterinary as a first degree. We don't have to do 2 degrees.
Right,
it's a slightly longer course. It's 5 years. And you want to, I think, see a person who you think can cope with practice. And sometimes we pick these super intelligent people. And a lot of the job is actually fairly straightforward. You know, you don't need a super A-level results to be able to squeeze dogs' anal sacs. You know, it's not, and it's something we do a lot of. So I think it's about picking people who kind of get the job and don't just see it as a romantic thing, which then after a year or two they fall out of. I think the other responsibility then is to make sure that we've got practices where actually, you know, it's okay to urinate during the day. You know, you can take a toilet break,
potty break,
have some time for lunch. So there's a number of elements there as to why I think, you know, people are diversifying. But you know, for me, it's still one of the best jobs in the world.
Yeah, I think this is an awesome segue for Dr. Gershon. I think this is like when you said this is a great degree to have. I'm like, all right, I need to ask Dr. Gershon about his project because
here
Dr.
we go,
Alaluf, you're working really hard on figuring out how we pick vet students, how we pick the right people, quote unquote right people, right? Who knows who the right people are? How do we pick people that start as a veterinarian and continue and finish their career and just, you know, survive? How do we do that better?
That's the $1 million question right there, right? You know, and it's very interesting because while he was talking, I was like, man, did he read my proposal? Because because basically the theory I'm using first off is the attraction, selection, attrition theory. And that basically means that if we attract and select the same type of people, we're going to have the same homogeneous population of veterinarians that we're looking for. So when you look at that, you know, there's a lot of people that say, you know, oh, veterinary medicine, there's so many things that go into it. The biggest thing is that people talk about the key word, the fun word, burnout. And the one thing they look through is they look at emotional exhaustion, even though there's more components to it than that. So what you need to do is you kind of look at someone who's going to be able to handle the emotional demands of the practice. The reason I'm doing the project I'm doing is because I mentored 20 previous employees into veterinary medicine, and they're all loving, thriving, and still in practice and enjoying it. So that was like, okay, you know, I'm not trying to bump my chest here, but what I do differently. So I kind of was looking at all the different things that I had done for all of my employees. One of the biggest issues, I think, number one is, yes, we accept on IQ, not emotional intelligence. So we're accepting students who are extremely.
No, we're selecting on academic performance, which is not the same as talent, right?
Exactly. So exactly. But I mean, well, the one question I always ask is, how many people do you know that probably have had 3,000, 4,000, 5,000 hours in the veterinary profession, but have no chance in getting into vet school because they only have a 3.2, 3.1, right? Which is still a very good GPA. And
probably
they're the
why
ones
John
who
and I
understand.
ended up in the islands, right?
Exactly.
Yeah, there you go.
Let me
We're
tell
not
you,
the smartest people in the
University-
world.
Ross University has produced some of the greatest veterinarians I've ever worked with. They, so yeah,
And St. George's too.
Yeah, St. George's, another one. I totally agree with what you're saying. It's just like, are we accepting ones who just are perfectionists because they've had to be perfect to get through high school? They had to be perfect to get through undergrad with a very high GPA to get into vet school. There are veterinary schools that only require 80 hours of minimum veterinary experience. And there are vet schools that accept students without any interview. I mean, so you're looking at that right now.
That's crazy.
I will say
that is insane.
the interviews can be crazy biased as well.
Yes.
Better looking extroverts do better in those interviews.
Well, yeah. Well, I mean, the thing is, I mean, it would be interesting, but we would never ever be able to get veterinarians to do this because trying to get a veterinarian to fill out a survey is next to impossible. But it would be interesting if we did a Myers-Briggs. Do a Myers-Briggs on every single veterinarian and see how many are introverts versus extroverts. Because when you look at emotional labor, there's two types. There's the surface acting where you fake it, right? You act like you care, but you really could give two craps about what's going on. Or you have the deep emotional labor where you're truly deeply emotionally involved. And a lot of veterinarians who have used the surface acting, that actually takes twice as much energy. And then they go home exhausted just because they had, number one, they're introverted. So dealing with people all day is exhausting and they had to fake it. Other things I'm looking at is I think there's a lack of mentorship. I mean, the mentorship in the profession is really lackluster at best. I know a lot of people say they're mentors, but mentors are more than just someone to tell someone how to do something. They're coaches. You introduce them to networks. You're a support. You're basically a parental figure to these people. And a lot of these people who said, yes, I'll mentor you are already emotionally exhausted and quote unquote burnout, right? So there's nothing left in the tank for them to really teach somebody. So that big study I'm doing through VIN. It's open for veterinarians that have been out 0 to 5 years. And I'm basically looking at all those different things with another thing, which is professional identity, which is what are your values? And if work-life balance is your number one value, I don't think clinical medicine is the best. And I don't like work-life balance. I think it should be called professional sustainability, but that's a different conversation. But I'm looking at it through stress, and I'm looking at stress 3 ways, which is surveys, interviews, and also salivary cortisol levels. I find it amazing in veterinary medicine. We are a medicine-based profession, yet we don't look at physiological values when we talk about stress. And when you talk about stress and cortisol, there's a condition called allostatic load where your cortisol is always raised. And the scientific evidence of what it does to the brain, much less we all know what Cushing's does to the liver, to the heart, to the skin, and everything else. But when it messes with your brain, you make horrible decisions. So that's one of the studies. The second study I have opened up because I'm having a hard time with the first study, and I just want to write this paper so I can go to bed. The second one is basically opened up to all veterinarians, and I'm looking at emotional labor and stress the same way, but I'm just looking at psychological safety, which comes down to, are you able to go pee during your work shift, right? The other one is resiliency, and the third one is just mental strength. I'm just curious just to see if there's any relationship there. But just recently, I've been talking with Dr. Wendy Dean, who's an MD. I don't know if you know who she is, but she is the one who has been doing all the research on moral injury in human medicine. And I think that's a big piece we're missing. I think in veterinary medicine, we're looking at people leaving the profession because of burnout. Yes, there is burnout, but we've been looking at burnout since 2000, 2001 in the profession, and things are just getting worse.
1983 was the first time JAPA published an article on burnout.
Right.
And I'm glad we fixed it since, right?
Yeah, exactly. So, but we haven't really looked at moral injury, and moral injury is something we need to look at. And basically what you're doing is we took an oath when we graduated, and we said we're going to practice a certain way. And now we have people with power influencing how we do things. And that would either be your ownership or leadership. And I'm making the argument that it's also your clients. So that is something that I am very excited. I'm starting to work on right now as we speak. So that is my next project. It's like all these rabbit holes. Once you get into academia, all your rabbit holes just start opening up, and you barely get any sleep. But no, it is something that needs to be discussed, and something that probably will give us some more answers.
I feel like vet school is such a protected environment, right? We go through vet school, we go through clinics, and you know there's a safety net somewhere, right? Like it's really hard to mess up like we could mess up in real life. And I feel like that transition, we're not doing that great in transitioning from such a protected environment to real life. And I think that's where the mentor comes in, like Dr. Jershin mentioned. Like the mentor is that middle of the road safety net from going from school to real life, where I had an awesome experience. I talked to them this morning, actually. So they've helped me through my whole career. And I think like they set me up for success. If I didn't have those mentors, I don't think I would have done as well as I've done. I don't know if you guys agree with that.
Totally.
1000%. My mentor that I worked for in undergrad, he moved me to the University of Illinois. He drove the U-Haul. And he was a groomsman in my wedding. And to this day, we still talk weekly. If you have
mentorship, it goes both ways, doesn't it? Like, don't you think that I feel like some mentors feel like they should sit on this throne, right? Just like this, like I'm sitting right now, and just waiting for the students to come over and ask questions, because they're the ones that have to be curious. They're the ones that need we're the ones that know where they're going to mess up. So it's a synergistic, combined, balanced relationship that we both have good intentions with each other, and we help each other out. First of all, to have a new grad that is successful, and then have my career and be successful and comfortable at it. So I don't know. I feel like our mentors need to be a little more aware of what's happening and aware of what the pitfalls are, and kind of help those newer grads get through it a little better, not just wait for them to ask questions.
But I think the environment also has to be set up such that good mentorship is possible. So you talk about, I really liked what Gershon said about professional sustainability over burnout, because, for example, in the Netherlands, the maximum number of days per week that a veterinarian will work is 2 or 3 days per week. Balance is inherently built into work life in the Netherlands. And so if you only work 2 or 3 days a week, and half of all veterinarians are still burning out within the first year, it's not a question of work-life balance. There's something else going on. And I think the same applies for mentorship in the field. We have to create an environment where people have the mental space and are feeling good enough in themselves and have the clarity in the room to take on, and as Gershon said, sort of be like a parental figure. I mean, it's a huge emotional and time investment. And if you are just completely strapped and you don't have any space for yourself, there's no way you can have space for another person and be a good mentor.
Bill, do you have that experience?
I have no mentors.
Tell me about your experience.
I worked for
no
good doctors who were terrible people. I did not have good mentors at all. I was alone.
How do you make it through
all
that?
The time?
Like how do you survive that? No mentorship.
One foot in front of the other. Just keep going. Like I didn't. You lean on textbooks. and you do a good job and you find a way through, and you, you know, I didn't last long at a couple of jobs, and I don't really regret those things. I think but there's always another job, right? Like, we're imminently employable in a dozen different ways. You know, we talked last week, and I told you I picked up an ER shift this past weekend, like somewhere else, not at my hospital, at a different hospital. And there's all sorts of ways to be a vet. So if you're like looking at burning out, like, and it's happened to me, I know Sammy's talked about it too, like, you find a way back into it and through it, and, you know, a way that is sustainable for you. And I think the answer for me, you know, was to open a practice. It wasn't the answer for Sammy, and that both of those things are completely okay and valid, right? Like,
yep, not the answer for me either.
I don't think so. I think vet med, you know, in school, you're like, this is the right way to do things. This is the correct, proper, absolute, appropriate way, and anything else is, you know, bullshit. And I think that's nonsense, right? Like, that's not.
Would
like,
you mentor people?
Ways forward.
Would you mentor people, and would you like? Do you think that would be important?
I try. We have one graduate. One guy who worked here now is a graduate from Cornell. He is now in the captain in the military. We have another guy who's about to graduate from Cornell, and we have another student who's an undergrad at Cornell. I guess everybody from Pennsylvania wants to go to New York. I don't know. But I mean, that's just the last couple of years of being open. But most of my job is getting out of their way, like just giving them opportunities, right? I can't set the fire in them. I can just give them something to do with it. Like, they've got to have the oomph before they get here, and a lot of them do. We haven't, you know, I've had trouble finding, you know, the next one of those people lately, but you know, the people who worked here were extraordinary. Like, I was lucky to have them. I don't know if they were lucky to have me.
Right, we'll have to ask them, huh?
Yeah.
Go ahead, Dr. Chadwick.
Just two things. I was at a conference, Vet Ed conference, which is a university conference in the UK. I think, you know, American universities go to it. And it was a lady who was in a study, and she was just following vets for a year to kind of see how they were getting on, you know, just after they'd qualified. And actually, just that physical, she wasn't a mentor or a coach or anything. She was just asking them questions. But by the fact that she was checking in on them, they were able to say, you know, is it normal that people are slamming doors in my face? Or, you know, they had somebody to talk to that they could go through things. And I think having somebody that's external to the practice is really important. So I had, you know, a friend, well, not a friend, but somebody from school who I knew, and his daughter had just become a vet. And this is the first year, and she's almost ready to give up. And we had to get to the point of saying, the situation that you're in at the moment with the practice that you're in is not the right practice for you. Don't give up on veterinary. Just as Bill said, find another practice. So I think having somebody sometimes outside of the practice is important. So that was a really interesting study. And I think it was just a case of them checking in. She was able to help them, you know, stay within the profession. Some obviously moved because, you know, you can hear if somebody's slamming a door in your face, you know, you shouldn't stay, so you should leave.
I also think it's worth telling these students that, like you told your student, or this young doctor, like, not everybody fits in everywhere. Yeah. And the expectation that you should is ridiculous, right? Like, there are most jobs in the world I would be very bad.
Yeah.
I happen to be good at this one narrow little corner of the universe. That I think fit is really important, and that's okay to look for that, and it's okay for it to change over time. And I don't think we need to, like, be right all the time.
Yes, belonging is something that we don't talk enough about in vet med, and I think that's a huge part of it. You need to find a place where you feel like you belong. And I think, obviously, I don't have data to back this, but I would guess, Anthony, if one of the reasons why those people felt more supported is because they didn't feel alone. And so even if it's somebody out of your practice, just having people that are going through it with you and you feel like you belong with those people, you'd be more likely to say, I think that builds resilience if you're not going it alone.
I got data for you. 37 to 40% in a study of new career grads, they said, why are you leaving? And everyone always says it's money. And people don't realize it's just easy. It's a cop-out to say, oh, I got a better salary, right?
Yep.
37 to 40% of these veterinarians that filled out the survey said it was mentoring. Mentoring is the reason there were a lack of mentoring. And it's very
lost. They probably feel lost. They feel
exactly.
And they feel alone
after vet school. Yeah.
All right. So let me ask a general question.
As a practice owner, how do you make them feel that way? Not lost.
Well, I mean, the thing is, one of the thing is, instead of a signing bonus, well, whatever. I mean, we Peter Weinstein, we have this little group called Vets for Pets, and we just had this discussion last week. One of the biggest things that you should really have is you need to have not only a business contract, you need to have a mentoring contract. And this mentoring contract needs to be built in both ways. So it covers both. That is just important as a business contract. So they know exactly, it's almost like a job description. What is expected of you as the mentor and what is expected as you as the mentee. So then you guys, so you can work through that. It is something that if you have some sort of document you can go back to, you can hold each other accountable, which that's another thing. I think we have a hard time holding ourselves as older veterinarians accountable for not being there for them. As a veterinary group, we are very stubborn. There's no way any of you can say we're not. And as a veterinary group, we're also very slow to evolve in our ways. And I'm sure Anthony with all his tech stuff is going to talk about it. That's one of the biggest issues is that we are like, oh, we've been doing it this way for 30 years. Why do we need to change?
Gershon, what were those stats again? You said what percentage left because of mentoring and what percent said money?
Oh, no. Most of the time people say, if you ask veterinarians, why did your associate leave? They will tell you, well, they told me it was because of money. But the empirical study said 37 to 40% said mentoring. And I'm not trying to give a plug, but a very good friend of mine, Dr. Danny Rabwin, who runs Ready Vet Go, is a 7-month mentoring program. And this lady she is external. She's not in the hospitals with them, but it's a 7-month program that new grads can go through where they hear from outside voices that have no idea about where they are or where they're working or what their clients are or anything, just helping them. Because the biggest issue is not the medicine. Veterinary school is very good at producing medically trained people, medically thinking people. They are awful at training soft skills. And that's exactly where it comes in, like slamming the door in your face. How many clients, how many doctors? I mean, we've all experienced it.
And we've talked about this before, but I think part of the problem in vet school is vet school still, well, in America it's still 4 years long, but the Merck veterinary manual is 1,000 pages longer than it was when I graduated. Like, that's a lot harder than it used to be. That's a lot more information. It's gigabytes more, medicine to learn and, techniques to learn and everything else. And it's, and the first thing we're so willing to cut in education is the soft skills. Oh, you'll figure it out.
Right.
Yeah,
Quote
it's so
unquote
true.
soft, right? Yeah.
And we're being taught by brilliant minds. I'm not saying they're not, but how many of them
disconnected from practice?
Exactly. How many of them have been in the front lines? It's like following a general into war that's never ever been on the battlefield,
but wrote a thesis on it.
I'll you know what? I'll extend that to not only professors, but people doing conferences, people speaking out there, people creating programs, people making software, people that are the top people that don't touch a pet in their day. And nothing against that.
They're doing
right?
it like
Dr.
one
Chadwick,
half day a week.
You forgot the most important one, John. Corporate ownership have never, ever step foot into a veterinary practice.
Oh yeah, hospital boards.
Yeah. And I think, I'm not saying that one's evil, one's not, one's good, but working together. Go to that person that works in the field every day. Hey, what I'm doing, is that correct? Like, does that really apply to your day to day? Like, just work together, collaborate, right? Or, we don't have to be in an ivory tower talking down. We could all be up top working together. And I think bringing that sense of practical approach to the ivory tower is very important, and there's a big disconnect, and I think we can do a lot better with that. I want to switch gears, because go ahead, Dr. Chadwick.
One last quick question to everyone.
Well, Chadwick raised his hand real quick,
Yeah,
so I'll have him, and then Dr. Jerson.
Just very quickly, Garth Jordan, who was president or CEO of AHA, he came to me and he said, we've got this white paper, can you help sort of spread the word about it? And it was called Stay Please. And I think mentoring is really important. But actually that paper is a really great paper. So for people listening in, as veterinary practitioners, either owners or, working for somebody, a lot of that was like common sense. So we read it and we go, yeah, well, it makes common sense. But actually, if you're not doing those things, you need to do them. So complimenting people, not shouting at them, giving the opportunity for, practicing good quality medicine, but understanding those soft skills that, we have to have contextualized care. It's a great paper. So that would just be a recommendation.
I think that's a really good paper. And I will also mention, I have heard a rumor from a very reliable source about that paper, that there were other professional organizations that discouraged its publication because it wasn't positive enough. It wasn't, the kind of like, oh, look, it's all sunshine and rainbows reporting. So it was discouraged in some sectors because it was what I would call candid.
Yeah.
I want to respect everybody's time. We're coming down, sorry, Bill, to the last 8 minutes. And I did have a bunch of topics here and stuff, but I know Dr. Chadwick, I want to talk about his kinetic study. I want him to kind of guide us to where we can read about it and just give us an idea of what it is and what the purpose of that is.
Everything I think is connected. So, Jerson's just been talking about sustainability within the profession. What we looked at there was environmental sustainability, but I think they're all connected. And actually, one of the interesting things was practices and vets were saying, we want to see suppliers doing more. Vets on the whole care about the environment. They care about animals. So they were doing things themselves, but not seeing it necessarily in practice, or the business that they were working for. So they want to see the suppliers doing more, but they actually want to see the practices doing more. And actually corporate vets felt that they wanted to see their corporate practices doing more. So another reason why vets will leave is if they feel that the business doesn't care about the bigger picture. It's just about money.
Misaligned values.
Doesn't care about the animals, doesn't care about the the environment. So it obviously we could talk a lot more about it, but I can certainly, Jonathan, send you that, and then you can put that into your chat groups and things, so that people, if they want to have a look at it, can. But I thought it was a really fascinating study, and we looked at pet owners as well. So pet owners kind of also want to see that vets are doing stuff, but actually vets are more committed to kind of doing more for the environment and for animals than the pet owners are. But I'd encourage people to look at it because it's a really, really nice paper.
Yeah, and it kind of light up a bulb for me. Like, I never thought of it that way, right? I'm kind of stuck in making my patients better, but what effect am I having in the environment or on the world? And it makes us feel like we're a little smaller than we are, but with the purpose of maintaining a world for our next generations.
Yeah,
that's One Health.
Yes, we're responsible for that. Jerson, you had a question.
Oh yeah, well, we moved on to kinetic study, but
let's go back. It's all good.
No, I'm just curious because I mean, I'm doing some relief shifts so I can just keep my ear to the ground and keep my feet wet. But there's been a trend now with new career grads coming out, and they're all worried about getting sued. Where does that start? Does that start in school?
I think it starts in school.
Yep. They train you for that. 100%. They train you for that.
Really.
If it's not in the record, it never happened. I heard that every single day. And so I write the most comprehensive medical records that are completely inefficient to cover my ass.
You ever thought of using AI to do so?
Now, yes.
Yeah. Okay.
But man, did that take me some time in the earlier years.
You know what saves my ass the best is having a good rapport with the client, being honest, being open, and knock on wood, I've been okay. I messed up like everybody has, but I think if you're open and clear, I think you can mess up. You can mess up and live through it, right? I feel like that fear really puts some shackles on veterinarians, and that's really sad to hear.
Same situation, Gershon, in the UK, but I think a lot of the vets coming out of university are more worried about being struck off because we can, I don't know what the situation is in America, but they all think that something's going to go wrong and they'll get struck off. So when I've given lectures to university, soon to be graduating vet students, I tell them about all my disasters in my first 2 or 3 years of being in practice. I'm still here.
What my mentors did. Yeah.
I haven't had a letter.
I was about to say, Anthony, you're being a mentor. You're being a mentor when you do that.
Yeah. It's a detriment to spectrum of care. The fear of legal action, because you have to always offer the gold standard at the fear of, the patient not doing well and you being attacked for it.
That's a good segue, Sammy. I had that on my list. Do you do spectrum of care, Sammy? Is that something that you makes you comfortable?
Every conversation I have, I always give 3 options. If they were human, this is what we would do. Here's the middle ground, which is completely okay. And then the third option is, in cases where they're really sick, always euthanasia. And so I always give 3 options. And there are 2 different kinds of doctors, right? There's the informational doctor. I think Atul Gawanda talks about this. There's like the informational physician that kind of gives you the information and allows you to make the choice. And then there's the doctor who tells you what to do, is a more authoritative hierarchical relationship. I tend to lead with the informative. These are the options. These are the risks. These are how it could go. This is what it costs. And ultimately the ball's in your court. And I support you in what decision that you make.
And not every client wants the same doctor.
Yeah, that's true. Some people want you to just tell them.
Some people want the imperious doctor. Like they want you to tell me what to do.
Bill, I've heard you say so many times, Bill, how you start your appointments kind of seeing what the expectations are from the client, right?
Absolutely.
So it's kind of a good way to set a good starting point for you to do your job. And is that how you practice spectrum of care, Bill?
For the most part, yeah. I think it also depends on where I'm practicing and with whom. Like when I work an ER shift, right? In the ER, you're you're the last line of defense, so you kind of ramp it up a little higher than you would in a GP practice day to day. But I also think you got to find out where people are with things. Like some people want you to do all those vaccines today, even if you say I don't know if that's a great idea. Some people want you to do all the diagnostics today, and some people are like, well, let's give them a shot of Depo and a shot of Convenia and rub a rosary and hope for the best. And I think, like you said, as long as you communicate that with the owners and do what Sammy does and write good records about it to cover your ass, I think you're okay. And even if you're not okay, if somebody's pissed about the outcome, you're still going to be okay. You can go on my hospital and read bad reviews people have left me, and you can see my extra spicy responses, and you'll be all right.
I'll write that down. That's on my list.
It's pretty entertaining. People do it recreationally sometimes, I hear, but you get like you'll be all right. And the new grads, like they get it beaten into them that like, oh my God, if you ever give a depot shot, you're going to jail. And it's just not the case.
Yeah, I agree with that. And I think part of practicing spectrum of care is providing payment options. I think that's
a really good conversation to have.
The last subject, the last topic I wanted to talk about, because it really matches everything we've talked about: the wellness visit decline, the diversity of careers, how we communicate with clients, spectrum of care. I really think finding a way for people to pay and do what they think is right, it's key in providing care to patients and having healthy patients. And in the U.S., we have some services I think we're all familiar. Go ahead, Jerson.
No, but I'm curious, when you say payment methods, are you saying the Bank of John or the Bank of Bill or the Bank of Sammy or the Bank of Anthony? Or
not anymore.
Don't come to my bank.
But no, but I'm trying to. So I mean, because that's the problem, right? Because trust me, I used to write off about $250,000 in bad debt every year when I owned my practices. But the problem is that if they don't have a credit card because they can't get one, or they don't get care credit because they don't qualify. So my question would be, should the Bank of John give them credit? And I know it's
I don't know.
I'm going to jump in here because you're actually not allowed to. You are not a federally approved lender. You do not follow those rules. You're not allowed to do this. And this is one of the reasons this is the reason I've stopped doing it, is it's against the law.
But I think like the angel
you're probably going to get away with
like
it. The angel funds are one thing, but like extending credit to somebody and like letting them pay over time, we're actually not allowed to do that. Like, we're not an equal opportunity lender. Like, that's not something we're supposed to or legally allowed to be doing.
I don't know, but what about in the old days, like in rural societies where there was like an exchange of services, you treated the cat and they gave you eggs, and that was just kind of how society ran back in the day.
I get it.
I've had people paint my exam rooms. I've had my roof redone at my clinic. I mean, there are things that you still can do on the DL, but the thing is, like, you can get burned. And I mean, the problem is that as a profession, I think we're very people pleasing, and we got into this profession because we want to help animals. But unfortunately, there is a cost. So the question I have then is, do we need to redefine the gold standard in order to get wellness visits up?
I think I'll jump in here. Kate Boatwright had a good post, and she's been on this podcast before, but she had a good post that, like, there's a big difference between standard of care and gold standard. And we need to start talking about those two things as different and distinct.
Different things. Yeah. I wanted to pick Dr. Chadwick's brain about, we're familiar with our payment options here in the States. I think we all kind of find a groove and, falling back in certain services. I don't want to say any specific ones. I don't want to get in trouble, or if they pay me, maybe I will. But Dr. Chadwick, what kind of options do clients have in the UK that you're familiar with? Like, in types of payment, like credit type payments, like pet insurance, clinics doing like those wellness plans. Like, what is working for the UK the best?
I think the big buzzword at the moment, which I think we're all talking about the same things, but the British and the Americans are separated by a common language. It was, I think Churchill said, because we can find it difficult. We all speak kind of the same, but a bit different. We're talking a lot about contextualized care, which is exactly what you're talking about there. And I think for me, it is about, certainly in my practice, we had a company that we could go to, and they would check credit worthiness of the client. We did it interest free. We lost 7%, but at least we got paid that money right away. And then they had the job of collecting the money from the client. But you also, don't want to labor somebody or burden somebody with huge bills that they can't afford to pay. So I think this is where contextualized care does come in. Just because we can do something doesn't mean we should do it. I think a difference in the UK is that our pets are much more likely to be insured than in America. I think in America, insurance has never quite taken off in the same way. So, I don't know the exact numbers, but in my practice, 20 to 30% of the animals were insured. I think people are doing better than that.
That's huge.
Yeah.
And that then gave you the options of not, killing the golden goose that was laying the golden egg. So you still, treated that in an ethical way. But it meant that people didn't need to worry about things, and I think insurance, if you're a wealthy person, you don't need insurance. But if you are struggling and you can get some sort of level of insurance, and often, with puppies, I'd be saying,
every single
you've
one.
got a bulldog.
Yes.
This is a dog that's worth insuring because you will be coming to the vets.
Every puppy.
Please take my advice. I'm going to give you 4 weeks free from Pet Plan. That's, one of our big companies in the UK. But it's up to you after that to carry it on. If you want to look for something cheaper, and there's different levels. Okay. You never know how good an insurance company is until it's time to pay a bill. And some are better than others. But we would have a lot more insurance. And, I think the contextualized care has kind of come back in a circle of saying, yeah, we need to make sure, as Gershan just said, we can't make it ridiculous for people to come in, because what happens then is you get less and less people. Therefore, to, make the numbers you need to make, you have to charge more and more. So that has to be a number that is sensible. And I think for routine visits, we shouldn't be charging as much because they're routine, and then we charge more for, people coming in for more complex things. But as, Gershan was saying, it's the nurses that are doing a lot of that stuff. So if we can get nurses involved more, we can obviously charge less to get people into the clinic, and then making sure that, they know where we are, when there are difficult situations. But again, if we've got insurance that allows us to offer, gold standard, but if we don't have insurance, as you were saying, Sammy, you give those 3 options. But I also agree at the same time, you need to have somebody who in the end says, and I use this line rightly or wrongly, if I felt it was the appropriate line, if it were my pet, this is the sort of thing that I would be doing as well. Because, I think Bill said it. Some people just want to be told, and actually, if you pussyfoot around too much, they then go, well, you're the professional person. I'm coming to you for advice. You don't want to give it to me. So I was always, I felt I knew more than they did about their pet from a medical perspective, but I was always interested in them when they came in and told me, he's not quite right, because they knew more than I did about the day-to-day of the pet. So it's having that holistic approach of really respecting the client. But on the whole, people come into you because they want your advice. And I think you have to contextualize it, because, if they are struggling, maybe they've lost their job, they can't probably do the same things as somebody who's wealthy, although we should never x-ray people's pockets. But I think we need to be aware of those complexities and those nuances.
I appreciate that, and I think it goes back to, like, every client's their own client, right? Like, everybody's different.
Yeah.
I know we're way over. I want to be respectful of everybody's time. John has stepped off because he had to. I think he had a patient or a very important phone call to take care of. Gershan, Anthony, thank you for your time today, your insight. Sammy as well, thank you as always, and to all our viewers and listeners, thank you as well. We'll catch you next month. Have happy holidays and a happy new year.
Goodbye,
Awesome.
everybody.
Thanks so much, guys.
Hopefully see you at VMX. Take care.
See you at VMX.
Bye-bye. Bye-bye.